Good evening. Hello and welcome to Hormonal Balance, Understanding Estrogen Dominance, a talk for men and women. I'm your moderator, Nicole. Before I turn this over to our wonderful team of providers at Philadelphia Integrative Medicine, just a few announcements. If you would like to submit a question for our team to answer at the end of the talk, at the end of our webinar, please use the Q&A screen on your Zoom screen. For those of you that don't know, Philadelphia Integrative Medicine is run by a team of wonderful providers. Joining us tonight is Zoie Phillips, our physician assistant and our presenter. You'll hear more from her soon. Erin Ariker, functional and integrative nutritionist, and Dr. Georgia Tetlow, our integrative physician. Before you hear from Zoie, I'd like to introduce Dr. Tetlow. Dr. Tetlow founded Philadelphia Integrative Medicine, or as we call it, PIM, in 2009, a model site for integrative and functional medicine applications and on-site clinician mentoring. PIM's vision is to empower, inspire change, create trust with patients, PIM providers, and staff, and the functional medicine community, and ultimately the medical community at large. PIM integrates the best of conventional and evidence-based integrative medicine, as well as tools to keep you well. Dr. Tetlow maintains a patient care practice as well as a mentoring practice for clinicians in transition or maintenance phases of integrative and functional practice. She began mentoring healthcare providers in 2002 and has pioneered a self-care curriculum entitled Honored Self. Tonight, I give you Dr. Georgia Tetlow.
Thank you so much, Nicole. I really appreciate that warm introduction, and thank you so much for moderating and for hosting us tonight. And we are delighted to be giving you our second installment of this very important topic, which is about hormones, but it's really about the symphony, the physiology, and about how all of these different aspects connect for you. So welcome tonight. As we do in each free evening class, I'd like to guide us in just a brief meditation. This is just an invitation for you to come present and to arrive more fully. I know that everyone may have had a full day. And so I'll ask you to find your feet and just get comfortable. Sometimes it can be helpful to uncross your legs and actually feel your feet on the ground. Taking a moment to think about what it is that you might be needing and where you are. If it helps you to lower your gaze or to close your eyes, taking a moment just to check in. Seeing how you are. Noticing any sensations, feelings. Thoughts. So I'm going to invite you tonight to bring yourself back again and again to your body and to the present moment. This evening is intended to empower you with information, a deeper understanding of your body and what your body is saying. And this is a special time in our world when we're asked to pause and think about what's really important and what would we like to be doing and where would we like to put our attention. What is important? So you matter. And thank you for coming tonight. Coming back again and again to your breath, to this moment, and to yourself. So beginning to complete your centering, you might wiggle your toes or fingers. Might feel good to stretch and to transition. All of you is welcome here. And we're delighted to have such a robust participation and such interest in learning about health, learning about balance, learning about all the things that you can do through your own self-care, through your own diet, and the choices that you make every day. So you have a lot of control and a lot of power. And sometimes your body doesn't speak English to let you know exactly what it needs. So we're here to assist tonight, to understand and to listen to that language of our symptoms and the language of your body, so that you can work together with yourself. Thank you, Nicole. Can we go to the next slide? So we are Philadelphia Integrative Medicine. We are delighted as providers to be joining you tonight. And sometimes when you go to the doctor might say, you know, your labs look fine. I don't see anything wrong. Looks good to me. Or they might say, yeah, I know you've got some real symptoms, but I don't know why. We might just need to wait a little bit longer to see if it advances a little bit so that we can get a label for you, because I don't have a label for this. I can't really help. And at Philadelphia Integrative Medicine, we're more interested in partnering with you and helping you understand where symptoms come from. And we actually have a lot more answers because we're looking at root causes. We treat all forms of chronic illness. Tonight we're talking about hormone balance, but every day we talk about every aspect. We talk about digestion and absorption and GI issues. We talk about thyroid health. We talk about how to cope with stress and what ways stress is expressing itself in your body. And we talk about bone health. We talk about every form of chronic illness in our clinic every day. And each of my providers and Nicole has been caring for patients all day. So we're glad that you're joining us as you've had a busy day, and we really enjoy these sessions, and we're here because we want to be as well. Wonderful news. Today we learned new information that the way our practice works is that we provide you with the paperwork so that you can get reimbursed from your insurer for your care. So you do that paperwork, and we learned just today that that is now possible no matter where you are in the country, no matter where you are in the world. So you are eligible for insurance reimbursement regardless of location. Very happy about that news, so that we can be providing that paperwork for you for that reimbursement. If you're new to PIM, we are available for free consultations. You'll learn a little bit more about that at the end, but that's very easy to schedule on our website. And we look forward to hearing your questions, how we might help you, how our approach might add to the conversation you might have started with your healthcare provider. Or maybe something you've never talked to your healthcare provider about because you didn't realize there might be something that you can do. Please join our newsletter. We put out our newsletter every 2 weeks, and we try and have that be content that is related to your self-care and related to your well-being. So without further ado, I would like to introduce our very special presenter. You might have already seen her and experienced her expertise last time for part 1 of the Hormone Balance webinar. And Zoie Phillips is, I like to use these adjectives to describe my very dear provider. You know, I like to call her spirited. I like to call her generous and expert. So Zoie has her Master of Science from Murphy-Deming, and she has been trained in multiple sources for her functional medicine integrative expertise. She trained with a very well-known provider named Dr. Jim Roach, who is very prominent in our field, and she's also experienced our own intensive clinician mentoring here at PIM. And Zoie sources her functional medicine training from the Institute for Functional Medicine and for the School of Applied Functional Medicine for a double board certification in functional medicine. Without further ado, I think you're really going to enjoy the evening. I hope you have a wonderful time and that this evening is really of value for you. Zoe, take it away.
Thank you so much, Dr. Tetlow, for that very kind introduction. I really appreciate that. Hi, everyone. It's so good to be here with you again for part 2 of this webinar. If you were with us last webinar, we did discuss some of these topics. We talked about estrogen dominance. What is it? What are the symptoms? What does estrogen do? What are the health risks? What does this mean for me? What caused this in the first place? How do I test for it? And we did start to talk a little bit about things that we can do to treat it. We talked about different foods. We talked about different ways to detox. And if you missed the first webinar, do not fret. We will be sharing some of the highlights from last webinar tonight. But tonight we will be focusing on learning a little bit more about hormones in general, how they're produced, and also a little bit more about supplements. How do they work in the body? How can we be sure that this is helping with my hormones and helping with balancing them? What do they do exactly? And what are these supplements? So let's begin. So I want you to be thinking, what comes to mind when I say estrogen dominance? Our goal tonight is to help you to answer this question by the end of the webinar. Hopefully you too will be somewhat of a hormone connoisseur by the end. So let's talk a little bit about estrogen dominance. What exactly is it? Well, a very simplified definition would be a state of estrogen excess that could be in both men and women that's not being properly balanced by other sex hormones like progesterone and testosterone. And we will be talking more in detail about these hormones tonight. We really focused on estrogen during the last webinar, but tonight we'll learn about the other family members of sex hormones, progesterone, testosterone, and some others. But I want to pause here. Let's go back to the previous slide, please. I do want to pause here for a moment and talk a little bit more about estrogen dominance. Because it can be very easy to classify this as just a numerical issue of just having estrogen out of balance. But what I really want to communicate tonight that estrogen dominance, it's also an expression that the host is out of balance. And really, estrogen dominance, when we think about this, we care most about the health of the host. This is why you are at the center of your health. It's about your metabolism of hormones and the proportion of hormones based on your environment, your biochemical makeup, your diet, your lifestyle factors, and more. So our goal as healthcare providers, as functional and integrative medicine providers, is to help you reestablish health and balance in you. It's not so much about tweaking and redirecting pathways, although this can be done, and we will share a little bit more tonight about what are those pathways and what influences them. At the end of the day, this is not about fixing something. It's about creating health in you to allow your body to be fully supported to create hormonal balance as an individual on your own. That's really our mission here. So I just wanted to spend a little bit of time really defining that definition in a more holistic way. So let's review from last webinar some of the symptoms of estrogen dominance. What does this mean? You know, what could this be? What will this look like? For women specifically, this could mean low libido, aka sex drive, irregular periods. They could have swollen or tender breasts or fibrocystic breasts, bloating, headaches, maybe some mood swings, feeling tired, maybe feeling a little down, a little depressed, maybe feeling anxious, noticing some weight gain, having some brain fog, trouble processing, insomnia, not falling asleep well, premenstrual symptoms, PMS, thyroid nodules, fibroids, endometriosis, and also polycystic ovarian syndrome. If you relate to any of these symptoms, you definitely want to pay attention to this webinar because this pertains to you. However, just because you may have one of these symptoms, it does not necessarily mean that you have estrogen dominance. But after going through this webinar, hopefully you will have a better picture of understanding if this relates to you. But we always encourage for, if you are thinking that this may pertain to you, that you see a functional medicine provider to help you ascertain that for yourself. Now in men, symptoms are a little bit less, but still just as significant. In men, they can have prostate enlargement, sexual dysfunction, infertility, and also enlarged breasts. So maybe you're thinking, you know, well, estrogen, that's just is the issue here. Is estrogen bad? And the answer to this is no. Estrogen is not the bad guy. We need estrogen for very important functions. We need estrogen to have a balanced mood, to make sure that we have supported bone health. We need to also maintain healthy cholesterol levels. It's important for that. And men and women, we want this to be balanced by other sex hormones and also safely broken down. However, when estrogen isn't broken down well, or if there may be too much, this can cause estrogen dominance. So let's talk a little bit more about what exactly estrogen is. What is it? Well, it's a sex hormone that is present in males and females. We often think that it's just a sex hormone in women, but it's not. Men have it too. And there are different forms of estrogen in our bodies. There's estrone, which is E1, and that is the precursor to all estrogens. We also have estradiol, which is E2. This is the most potent form of estrogen. And this is what is responsible for the secondary sex characteristics. And it also helps to support bone growth and serotonin levels, which make us happy, the happy hormone, memory, and also heart health. And we also have estriol, E3, and this is mainly predominant during pregnancy. We also know that it's possibly protective against breast cancer. So what about these estrogen metabolites? So as you can see, we have estrone, estradiol, estriol, but then these estrogens are further broken down into what's called metabolites. And we have 3 metabolites. We have 2-hydroxyestrone, 4-hydroxyestrone, and 16-beta-hydroxyestrone. And we'll talk a little bit more about those now. So first, we'll talk about 2-hydroxyestrone. This is actually a very good metabolite because it works to block stronger estrogens. It actually binds to the 4-hydroxyestrone and inhibits it from binding to DNA to cause DNA damage, which we'll talk about in a second. So 2-hydroxyestrone is a good metabolite. Next is 4-hydroxyestrone. Now this, we like to, it's not always as simple as good and bad, but for general purposes, this is a bad metabolite, so to speak, because it's associated with an increased DNA damage and breast cancer risk. And next is 16-beta-hydroxyestrone. This metabolite is also bad as it promotes cell proliferation or cell turnover, which means an increased risk for cancer. It's also associated with obesity, higher levels of omega-6 fatty acids, which are inflammatory, pesticide toxicity, and also hypothyroidism. So it turns out estrogen dominance, it is more than too much estrogen, because it also involves differences in ratios and imbalances among the 3 types of estrogens and their metabolites, how they're processed. So for those with estrogen dominance, the best way to bring back balance, that homeostasis, is through a treatment approach that is multifactorial, that will address detoxification, will address the foods that you're eating, supplementation, and other things. But I will remind you again to keep in mind that estrogen dominance is, our focus is on building health in you, and especially throughout these different treatment modalities, we are addressing the whole person and building health in general with good food, whole foods, and detoxification and such. So let that be our focus. So what can we do to detox? What are we going to do in terms of food? What can be helpful? Well, for estrogen clearance to help that process, there are certain foods that are excellent for this, such as foods that help to restore estrogen receptor expression, such as broccoli and kale, collard greens, cauliflower, and also cabbage. And we also know that foods from the Brassica family contain a compound that's called indole-3 carbinol, sometimes called I3C. And this again helps to lower estrogen. And these foods include turnips, mustard greens, wasabi, Brussels sprouts, and also bok choy. And some additional foods to eat that can be helpful are foods that are high in omega-3 fatty acids. And we're going to talk a little bit more about this tonight, but these foods would include wild-caught fish, also seeds, and also nuts. Now, what foods should we think about avoiding? Well, we definitely want to avoid hormone-injected meat and dairy. The reason for this is because those hormones can easily be conferred to us when we eat the animal products. We also want to avoid foods high in pesticides and also foods that are non-organic. The reason for this is because most produce that you pick up that does not have an organic label on it was sprayed with Roundup, glyphosate, and this increases estrogen, and that's conferred to us when we eat them. So it is important to avoid those pesticides. And we will talk about soy in a moment, but I would like to refer back to a slide where we talk a little bit more about detox. Nicole, this is a slide just prior to the foods that we mentioned. I want to make sure that we spend some time talking about different ways to clear out excess estrogens other than food. So what does this include? What can we do? Well, when we think about detox, we are thinking about foods. Foods are medicine, and this is one of the best ways to regulate our hormones. However, there are other ways to help with this, including stress. And the reason for this is that when we're stressed, those cortisol levels come up, and that can help to promote estrogen. We want to encourage you to exercise, to sit in saunas, to sweat. This is your body's natural detoxification process. Again, that helps with the removal of those estrogens. We also want to minimize heavy metal exposure. Maybe you're thinking, well, I don't come into contact with a lot of metals, but they can be sneaky. They are more prominent in our lives than we realize. Mercury, for example, is something that we often ingest without realizing it, contained in different fish, particularly tuna. And this is, again, something that we could test for as one of our testing options to see if you have heavy metal toxicity that can have many ramifications other than hormonal imbalance, such as neurological effects. We also want to think about avoiding the use of plastics. The reason for this is because plastics contain a compound called BPA, and that compound induces estrogen-like activity and operates as a xenoestrogen, a word meaning a fake estrogen, that can plug into the receptor sites in our body for estrogen and increase our estrogen levels. So if you're like most Americans, you have your water bottles on handy that sometimes sit in the car for a couple of days, and we might take a swig a couple days down the road without realizing it. This is actually increasing our estrogen, because those BPAs those BPAs contained in the plastic actually are leached out more so when plastics are heated up. So we want to avoid putting plastic in the microwave, in the dishwasher, things like this. And we want to opt for glass or stainless steel. We also want to avoid hormonal birth control. And this is for quite obvious reasons. Birth control often contains synthetic, meaning fake, estrogens. And this is one of the main reasons why so many women suffer from estrogen dominance, because they take excess estrogen on a daily basis as a means of contraception. This can disrupt your hormonal balance and have you on the scale of progesterone, estrogen, and such, have you more estrogen. We also know that with detox, using non-toxic personal care products can be huge, because most personal care products that we use contain hundreds of chemicals, some of which we are not privy to actually knowing. Some products do not list the exact ingredients that are used, and words like fragrance can entail a myriad of different chemicals. And so what happens is that when we use these personal care products, we put them on our skin. Think about all the personal care products you use in a day: your toothpaste, your body wash, your face wash, your shampoo, your conditioner, hair products, women, makeup. The list is quite lengthy if we would tally them up. Also keeping in mind cleaning products. When we put these items on our skin, not the cleaning products, obviously, when we put these personal care products on our skin, the xenoestrogens, the compounds that mimic estrogen in them, are absorbed through our skin. And we have our liver, when we ingest foods and medication, helps us to detoxify big time. So without our liver being involved, when those compounds are absorbed directly into our skin, we don't have the benefit of our liver helping us with detoxification. So this is one very important way to lower our estrogen exposure. Another is losing excess weight, because estrogen is stored in fat. So losing weight would mean less storage space for estrogens. And we also want to drink clean water, because toxins and potential endocrine disruptors are in our drinking water. Now, I'd like to go back to the slide where I mentioned foods that we want to avoid. And we know that, especially from our last webinar, soy is a hot topic. And to shed some light onto this topic is Erin Uriker, our fabulous PIM integrative and functional medicine nutritionist. She's going to share with us a little bit more about soy. I really enjoy working with Erin. She brings such care and such level of detail to her patient care, which I very much appreciate. So Erin, take it away for us, please.
Oh, thank you very much, Zoe. Hi, everyone. Good evening. Glad to be here, and thank you for attending. If we could move to the next slide, please. So really, I'm just going to cover some education around soy. And for your safety, the information I'm sharing is really educational in nature and not intended as medical advice. So please work with a qualified healthcare practitioner to assess your individual case. Nutrition is highly personalized and it's based on a variety of factors for each individual. Next slide, please. So soy isoflavones or phytoestrogens, these are plant-derived compounds with estrogenic activity. So the degree to which soy isoflavones exert estrogenic and anti-estrogenic effects in humans is a current focus in research. And so there are estrogen receptors that are a group of proteins that are found inside the cells, and there are two classes, alpha and beta. And the soy estrogen receptors are present in various tissues, including bone, liver, and brain, in addition to the reproductive tissues. And phytoestrogens can preferentially go to the estrogen beta receptor sites versus the alpha, which can act like estrogen in some tissues, but block the effects of estrogen in others. So the anti-estrogenic effects in reproductive tissue could potentially reduce the risk of hormone-associated cancers such as breast, uterine, and prostate. While on the flip side, the estrogenic effects in other tissues, such as the other ones that I mentioned, outside of the reproductive, they could help maintain bone mineral density and to improve blood lipid markers. So increased soy intake early in life may decrease breast cancer risk in adulthood. And this is based on observational studies. And what's meant by that are studies where there are no experimental intervention or treatment. The study subjects or participants are simply observed over a period of time. And so there is a notable difference in those in Asian countries versus those in Europe, North America, Australia, and New Zealand. So there are several factors, including hereditary and lifestyle factors, that can contribute towards the differences we see across these different countries. So the high soy isoflavone intake from Asian countries has been suggested to potentially contributing to reducing the risk of breast cancer. While on the flip side, in Europe, North America, Australia, and New Zealand, we see more of an elevated risk of breast cancer, where the average isoflavone intakes in non-Asian women are generally much lower. So eating soy in moderation, safety is a concern. If you could go back to the previous slide, sorry. Thank you. The last bullet point here. So safety is a concern with high intakes of eating soy. And so from some of the experts' view on this is that women with a history of breast cancer, particularly the estrogen receptor positive breast cancer, should not necessarily increase their soy consumption, but there's not enough evidence to discourage breast cancer survivors from consuming soy foods in moderation. As in any food that you're going to consume, moderation is typically the key. Next slide, please. So I want to just cover some other considerations about soy. The benefits, so it is a complete protein. It provides all the essential amino acids that you need from food that your body can't make. And so this would be a very good source of protein for those that are following a vegetarian or vegan diet. It can also help with metabolic dysfunction, so it can be helpful with blood sugar regulation, LDL cholesterol, and reducing blood pressure. And with any food, including soy, you want to choose high quality, minimally processed, non-genetically modified soy to include in your diet. The organic, fermented, and natto, miso, and tempeh are the best sources if you're going to consume it. The other consideration that is around soy is that it is a common food allergen and a common food sensitivity. So some of you may be familiar with an elimination diet. The elimination diet is used to identify certain foods that may be causing a sensitivity, so it's not as drastic as an actual allergen, but it can lead to various issues, and soy tends to be one of the foods that's commonly used in the elimination diet, where you're removing foods for a period of time and then you slowly reintroduce one at a time to see if you have a reaction. And for different people, it can be different things. It can be GI issue, it can be brain fog, it can be rash, it can be mucus. It depends on the individual. And it's also a common food allergen that's marked on food labels. So it's something that to be aware of, that if this is something that you have tried on an elimination diet, or you know you've been tested for an allergy for this, these are just kind of bigger parameters to think about when you're considering adding soy to your diet. And with that, I'm going to turn it back over to Zoe for her to continue with the presentation.
Thank you so much, Erin. Okay, so what you see here is the pathway for steroidogenesis, which is the processing of sex hormones. And this is a little complicated, but don't worry, we're not going to be getting this detailed. Let's simplify this. Thank you, Nicole. So this is the steroidogenesis pathway, much simpler. And what I want to share with you tonight and focus on are these words in red. You will see aromatase and also 5-alpha reductase. These are enzymes that in our body that allow for the conversion to take place. For example, if we look at testosterone, we see that there's a 5-alpha reductase in that red lettering. That's what allows testosterone to be converted to DHT. Now we're going to talk about these hormones, so do not fret, but we also can see the word aromatase. This is another enzyme that allows for the conversion of testosterone to estradiol, one of the estrogens that we talked about. So as you can see here, this pathway shows us that these different sex hormones are made from one another, and they all start with cholesterol. And this is really important. This is why we talked about cholesterol and estrogen, the connection, the correlation between the two. We can get very detailed in how these hormones are created and how to balance them. But what's important to realize is they all start with cholesterol. So if we do not have enough cholesterol, we will not be able to make enough sex hormones. So cholesterol is important. This is the first factor that allows for the creation and the processing of these sex hormones. And as you can see, when we look at the estrone, estradiol, the estrogens, the 3 different types of estrogens that we talked about earlier, they start as androgens. They start as testosterone. So what we'll talk about tonight is, we won't get too terribly detailed, but this is important for us to talk about because it shows us, and we will see here in just a few slides, how different supplements work in your body. How do they, what is the science? How do they actually work to lower estrogen and to create more hormonal balance? So I'm really excited to get into the nitty-gritty. Hopefully this wasn't too detailed for you. However, it is, to me, I find this fascinating to know how these supplements are actually working. It can feel a little bit confusing sometimes. You know, is this really working? Is this really doing something in my body? And I'm excited to show you exactly how it works, why these supplements are backed by science, and they're clinically proven to help with balancing hormones. So let's talk about some of these other sex hormones, because last webinar, estrogen was the star of the show, but we talked about progesterone. What is that? So progesterone is a steroid hormone. It belongs to a class of hormones called progestogens. It's secreted by the corpus luteum. which is a temporary endocrine gland that the female body produces after ovulation during the second half of the menstrual cycle. And also, progesterone for many women can be really helpful for other areas such as sleep. If you're our patient, you may have heard us talk about this before, or maybe you have experienced the benefits of progesterone as well. Now, we can have too much of a certain hormone, and this is something that we want to mention as well. Too much progesterone may cause you to feel overly sleepy. And you may also notice abdominal bloating, just like excess estrogen, or feeling full even if you haven't eaten. So that's a little bit about progesterone. Let's learn a little bit about testosterone. What is testosterone? It's an androgen sex steroid and hormone in males and females. We always associate testosterone with males. But let's not forget, women, we have testosterone, and it is produced in the ovaries, also adrenals, and also peripheral tissues. And it is very important for libido and also bone health. And it is associated with enhanced mood and motivation and just a general sense of well-being. Let's also talk about dihydrotestosterone, DHT. What is this? It is an androgen sex steroid and hormone, and again, males and females, we all have this. It is the most potent androgen in the body. If we have too much DHT, we can have acne and increased facial and body hair growth. We can experience male and female pattern baldness, and we can also experience aggressiveness and irritability. So again, this is the simplified pathway, the creation of these sex hormones. Next slide, please. So what is our goal with estrogen dominance? Well, we know that we have excess estrogen. And what do we want to do? What do we want to create? Well, we want to create balance. And in order to do this, we want to focus on things that are going to help increasing testosterone and increasing progesterone. That's why you see a little check mark. And we also want to focus on blocking the pathways that allow for the creation of estrogen and also the creation of dihydrotestosterone. We just talked about that and the negative side effects of that as well. This is our goal. So let's talk a little bit about supplements. And I really want to focus on this slide because we are going to talk about different supplements. But I want you to know this is information for you. It's educational and it's not medical advice. And so supplements, they really should be recommended by and also supervised by a healthcare provider and also informed by testing. We want to make sure that when it to hormones that we are safe, that we are checking hormone levels. We'll talk about the testing options in a little bit. But we encourage you to work with a healthcare provider to assess you. And I also wanted to share a little bit more about supplements in general. Not all supplements are created equal. Supplements are widely available. You may notice them in Walmart or Rite Aid or Walgreens, but you also may notice them through online companies, and there is a spectrum of supplements. And it is very important for us to remember that supplements are not FDA regulated. What this means is that if you are to purchase a supplement, if it is not third-party tested, you cannot be certain that what's in that supplement is truly in that supplement, the dosing and such. And with cheaper supplements, oftentimes these are less absorbable forms of the particular vitamin or nutrient, what have you. These supplements, when they're cheaply produced, could also contain fillers and additives that can inhibit your body from fully absorbing the intended ingredient. So for that reason, at Philadelphia Integrative Medicine, we do recommend for our patients higher quality supplements. And the reason for this is because we want to make sure that you are getting the intended supplement that you're expecting to have, that you are getting the most available form of your supplement. If you're going to, be taking a supplement, we want it to get absorbed into your body. So please know that all supplements, they're, again, not created equal, and that there will be, there is sometimes a very stark price difference in supplements. But there is, along with those higher end supplements, becomes guarantees of purity, again, being third party tested. And this matters. For example, when we think about fish oil, very cheap and poor forms of fish oil can often contain heavy metals like mercury. And again, this mercury can build up in our bodies, and we can have neurological effects. So the supplements, they matter. And this is why we recommend for our patients certain brands, certain doses. Everything that we put in or on our body can have some sort of side effect. And we do appreciate the fact that supplements, in comparison to pharmaceuticals, they have a much lower side effect profile. And we love that. We want to help in a more holistic way and avoid any unnecessary side effects from pharmaceuticals. So in order to do that, we really want to focus on purity, and we just want to make sure that we keep your safety in mind at all times. So please know this as we go moving forward. If you have questions about whether these supplements are right for you, I encourage you to be seen as a patient, either by us or someone else who understands supplements. We would love to be able to work with you. But again, know that this is highly personalized. So I just wanted to share that with you before we talk about these supplements. We don't want you to running to go to the store to pick out the supplements and take them. We want them to be supervised by someone who is picking that for you. Remember, that's the beauty of integrative and functional medicine. This is about tailoring a plan for you, for your individual biochemical makeup. And we don't want to fall into the category of protocols. We want this to be personalized. So again, this is for educational purposes. And if you have specific questions, come see us. We would love for you to be a patient. So let's talk about the first supplement, which is vitamin D. So next slide, please. So what is vitamin D? Well, vitamin D is a fat-soluble vitamin, just like vitamin K, vitamin E. So how does vitamin D, what does this do? How does this help to lower estrogen? Well, first of all, vitamin D is a hormone modulator. It helps to balance hormones. How does it do that? Well, it acts as an aromatase inhibitor. So we talked about this a little bit ago. We talked about aromatase. What does that do? Well, if we look at this picture in the upper right-hand corner, we can see that in order for testosterone to be converted to estrogen, we need the enzyme called aromatase. And vitamin D actually blocks this enzyme from working to allow your body to funnel your hormones into more testosterone and less estrogen. So this is how it works. So increased vitamin D would mean decreased estrogen and increased testosterone. And when we have increased testosterone, we have better estrogen and testosterone homeostasis, aka balance. So some important facts about vitamin D. When we supplement with vitamin D, we always want to include vitamin K. Why? Well, because vitamin D causes your body to absorb calcium. And this can calcify your arteries and soft tissues. This can be a health risk. However, vitamin K paired with vitamin D allows your body to take the calcium from your arteries and soft tissues and put it back into the bone where we want it. That is where we want our calcium. So for some of our patients, this is one of the supplements that we particularly or commonly recommend, and that pairs the vitamin D with vitamin K to make this a very safe and protective supplement. Okay, the next supplement that we're going to talk about is turmeric. Next slide, please. So what is turmeric? Well, turmeric is a flowering plant, and it's a spice used all over the world. You might have it in your spice cabinet. Has that lovely golden yellow color that stains everything if you spill it. I know we've all had that experience. I have. What does it do? How does turmeric help to lower estrogen? Well, just like vitamin D, it is also a natural aromatase inhibitor. So it stops your testosterone from becoming estrogen. But what else does it do? And it also, like I said, it helps to block estrogen. So it also can decrease inflammation in the body. It can also decrease estrogen, like I said, and increase testosterone. And as we know, extra testosterone would mean, for those with estrogen dominance, can mean better balance, hormone balance. Now, I mentioned that turmeric decreases inflammation. This is because it operates very similarly to something you probably have in your medicine cabinet, an NSAID. What I mean by that is ibuprofen, Aleve, Advil. It works very similarly to NSAIDs. It's a COX-2 inhibitor. It lowers pain and inflammation. So this may be something that you may elect to use for pain and inflammation. However, there is a caveat, and this is, again, illuminating the idea that these supplement recommendations are personalized. In those with iron deficiency anemia, curcumin can actually bind to iron and lower your iron levels. So again, this is why we make sure to check labs and make sure that this is a very safe and appropriate supplement for you. Okay, the next supplement is zinc. Next slide, please. So what is zinc? It's a natural mineral present in every cell. So just like vitamin D, just like turmeric, it is a natural aromatase inhibitor. So it blocks the conversion of testosterone to estrogen, which increases testosterone, lowers estrogen. But something also very special about zinc is that it works to block the other enzyme called 5-alpha reductase. This means that it helps to lower that dihydrotestosterone that we talked about a little bit earlier, that can cause irritability, aggressiveness, female and male patterned hair loss. So this works on both enzymes. So it helps to decrease estrogen, decrease your dihydrotestosterone, DHT, and increase testosterone. And again, this is helping for those with excess estrogen create more of that hormonal balance. Let's go back to that slide, please. I wanted to share a little pearl for you about zinc. I know that zinc is a very common supplement used for immune function, and that's widely understood. And I do want to point out, though, that more zinc is not better. The reason for this is because zinc and copper have a very special relationship. Copper, they work in opposition, meaning the more zinc that you take, your copper levels can lower. And this can cause all sorts of symptoms like low copper, fatigue, weakness, getting sick often, weak and brittle bones, difficulty with memory and learning, and so many more other symptoms. So again, another reason to make sure that this is personalized for you, that we just don't go crazy on the zinc We don't want to lower your copper levels. You want your nutrient levels to be in symphony. We want them to be balanced. Okay, the next treatment option is a supplement called VITEX. Let's talk a little bit about that. VITEX is a plant that is native in the Mediterranean region. It is a popular botanical and it's used often for hormone regulation. Well, how? What does it do? It naturally increases progesterone, which has been shown to improve heavy periods, sore breasts, and irritability. And so with increasing progesterone levels in those with estrogen dominance, it can help to create better hormone balance between estrogen and progesterone. But there are caveats to this as well. It may not be helpful in postmenopausal women, and it may affect the timing of menstrual cycles. So this is a decision you want to have with your functional or integrative medicine healthcare provider. Okay, the next supplement is a supplement called DIM. And this stands for diindolylmethane. It's a compound derived from something called indole 3-carbinol. You might have remembered me mentioning that when we were talking about different sulfur-containing vegetables like the broccoli and the cabbage. And this is found in those vegetables as well. How does this help? Well, it allows for estrogen to come down that 2-hydroxy pathway. And if you remember, that is that good pathway. That is the good pathway that helps to lower breast cancer risk and other estrogen-related cancers as well, not just breast cancer. It also allows your body to free up testosterone. And again, it acts as an aromatase inhibitor, just like vitamin D, just like zinc, just like turmeric. And that means it will help to lower estrogen, increase testosterone. So when we increase DIM, we're getting decreased estrogen and also increased testosterone. And that will allow for better balance, better hormone balance. And our last supplement is magnesium. So what is this? Well, it's a naturally occurring mineral. Fun fact, most Americans are deficient in magnesium. How does this help with estrogen, with hormones? It's a natural calcium channel blocker, which means it relaxes all the muscles of the body, including the muscles of the GI tract. And so what this does is allow for bowel movements. And we know that one of the fundamentals of integrative and functional medicine is motility. It's something that we don't talk about very often, but it's important to have regular bowel movements because this allows for efficient removal of those excess hormones. This is our body's natural way of removing the excess hormones. Our body is always working so hard for us. It's always on our side, working so diligently when we really sometimes take it for granted. And this is really why regular bowel movements are an important piece to this puzzle. And what allows for, what can help with that is magnesium. There's so many benefits to magnesium. Like I mentioned, because it helps to relax muscles of the body, it can also help with muscle aches and tension, and it can help to prevent migraines because it helps to make blood vessels larger. So many wonderful benefits with magnesium, but really helpful in inducing bowel movements to allow your body to clear out and do what it does best. So a little about magnesium. Let's talk a little bit now about testing. So this sums up our supplements. This is really just a drop in the bucket when it comes to supplements options that are helpful for hormone balance. There are many, many, many others. This is just a very small selection. So we've gone through the supplements. We've talked about the symptoms. We talked about, different ways to detox. Well, how do we know if this is true for us? What do we do? How do we figure that out? Well, we can do a Dutch test. This is a hormone test, and it says female hormone, but I want you to know that men can do this test too. So that is a typo. It is a Dutch hormone test for anyone, for men and for women. And it's a dried urine test, so you can do it in the comfort of your own home. And it looks at the sex hormones, but if you notice, I know this picture is very small, we can see how it shows the metabolites of estrogen. It shows the 2, the 4, and the 16 metabolites, the estrogen metabolites. And it again can allude more to your risk of estrogen-related cancers. We want to see those dials in a good range for those more bad metabolites like 4 and 16. And so this can show us what exactly is your risk, and not just that, but how well prepared is your body, equipped is your body to detoxify those estrogens. And so this allows us to tackle the root cause of hormone imbalance. We do not want to we want our focus always to be on the root cause. Let's support your body to do what it does best, to balance your hormones. Your body wants to do that. It might need a little nudge, but this test will allow us to figure that out, to learn more about the different phases of estrogen detox. And so this is the superior test, in my opinion, when it comes to testing hormones. But it's not the only option to look at sex hormones. We can also look via regular lab work, such as labs from LabCorp or Quest. However, there are some drawbacks. There are some cons to this testing option. It will only provide the level, the number of sex hormones. So this can be a detriment because it will not show us the details of how your body is metabolizing those estrogens, and not just estrogens. If you can see on this picture, we can see the breakdown of progesterone and the breakdown of your androgens to give us even more insight to some of the symptoms that you may be experiencing. So with regular labs, you do not have this background information. So we're only looking at numbers. And this may be fluctuant based upon women where you are in your cycle, if you're still menstruating. Again, some drawbacks to that, but it is another viable option for testing sex hormones. Okay, so I want you to be thinking now what comes to mind when I'm saying estrogen dominance? Next slide, please. So hopefully after this part 2 webinar, and hopefully you were able to listen or join us for part 1, you were able to think about hormonal imbalance, what is estrogen dominance. You were able to think about, oh yeah, it's when estrogen is in excess in comparison to those other sex hormones like progesterone and testosterone. And hopefully you're thinking about some of those symptoms that can come about from excess estrogen, like low libido and weight gain and mood swings, fatigue, feeling low. Hopefully you also thought about that sometimes very confusing steroid pathway, that steroidogenesis, how the hormones are made, how estrogen comes from the androgens like testosterone. And hopefully you also thought about some treatment options. We talked about aromatase inhibitors, things that block the conversion of testosterone to estrogen, like turmeric, like zinc, like vitamin D, like DIM. Hopefully you remember those supplements that can promote progesterone, like VITEX, and also minerals like magnesium that will help with motility and allow your body to clear out those hormones to do what it does best. So at this time, I'd love for you to start using that question and answer tab at the bottom of your screen. and think about some questions that you have. We've just talked about a lot, and I'd love to know what questions that you have. We will spend some time answering them. And why I want to provide you with some time to do that. So we're going to be going through some announcements, some exciting announcements, but just know we are coming right back in just a few moments to answer those questions.
Hi, everyone. So we have a call to action here that we're asking you as participating in the webinar, if you feel so called to do so, is to share the information about PIM with family members. We do offer free consultations where you can ask some questions and get to know us better and see if this would be a good option for you to schedule an appointment. Please look at our resources page with the website listed here, and we invite you to read our newsletter. Our next evening talk series is going to be on July 29th from 7:30 to 9, same time, same place. The topic is going to be a healthy gut supports a healthy life, and our nurse practitioner, Linda Sherland, will be our presenter, and we'll also be there too. So the healthcare workers and integrative professionals groups, this is a wonderful group that meets monthly. It really helps to provide self-care, and it provides a safe space for other healthcare workers to get to know each other. If you attended the IFM conference over the weekend and you heard Dr. Tetlow speak in her presentation and refer to this group, this is the group, the Healthcare Workers Integrative Professionals Group. Normally it's the first Monday of every month. However, next month it is going to be on July 13th, which is actually the second Monday, but normally it's the first Monday. But July 13th, that Monday from 8 a.m. to 9:30, that event will be held. It's a great time to start your day and get some self-care in. We invite you to join us, and please go to our events tab to register. We also have a provider lunch that's held via Zoom meeting, just like this webinar. This is for healthcare workers and integrative professionals as well. It's from 11:45 to 12:30. It's a great networking opportunity. You get to meet other providers and learn about what services they provide and share information. Again, please visit our events tab to register. And we thank everybody for coming tonight. We really appreciate the great attendance. And we will be taking a look at your questions and going through the Q&A.
Thank you so much, Erin. I'm so excited. Let's dive into some of these questions. These are fantastic. You guys are doing an excellent job. These are wonderful questions. So let's spend some time unpacking them. So we have a question, and I will use first names when I'm talking about these questions. So if you would not like your name to be used, you can just enter as anonymous. So we have a question from Jen. She says, my 24-year-old daughter is on the pill. What would you recommend as an alternative? Excellent question. This is a very hot topic because for most women, the contraception options are largely based on exogenous, meaning external sex hormone not replacement, but use. So synthetic estrogens, synthetic progestins, for example, the birth control pill, like Jen is mentioning. So this is are the most popular options. However, it's not the only option. There are many non-hormonal options, and some of which include fertility tracking, basal body temperature checking, and many others. And this is one area in which I talk with some of my patients, and we spend some time unpacking what is what are my options, and what is going to work for my lifestyle. So for that reason, I would encourage your daughter to see a provider who's able to talk about these options that's best for her, because there are many non-hormonal options, but they might not be right for your daughter. You want her to be able to have that, make that decision for herself. So that would be my response to a question about birth control. Great question. So many women are taking it. We have another question. Let's see here. Okay. A question from Meredith. She says, what about plastic that is labeled BPA free? Can that still be bad? So something to keep in mind is that even if some containers or objects, what have you, are labeled BPA free, they can still contain chemicals without having to mention them. And there are many different chemicals that are allowed to be included in different containers and plastics and such, that manufacturers do not need to disclose to the user. So we cannot be certain that just because plastics are labeled BPA free, that they are not still, quote, bad. They still may contain chemicals that can be xenoestrogens that plug into those receptor sites, estrogen receptor sites in your body, and can still shift your hormonal balance. So again, with containers and such, you always want to stick with glass, and you always want to stick with stainless steel. These are two really good options that you can feel really safe about for your body, for yourself. Okay, let's see. Dr. Tetlow, do you want to answer some questions here? And I think you're on mute.
And I should be unmuted now. Thank you, Zoe. Rookie mistake. Wonderful presentation. I just so enjoyed it. Thank you so much for all you did to prepare that. Thank you, Erin. Thank you, Zoe. And thank you for our team. There's a question from MLB 49. I have been avoiding soy for years because I had been told and had read that it was not good for people with Hashimoto's thyroiditis. Is this valid or no? So there is information that, especially when you've got Hashimoto's and your thyroid is underactive, you have hypothyroidism, soy has lots of actions. It's a powerful food, and it can affect absorption of thyroid hormones, and it can also affect production of thyroid hormones because it's involved with iodine pathways and zinc pathways. And so that's a consideration. And it doesn't mean you shouldn't eat soy. You know, soy is so good for all the reasons that Zoe mentioned, including your cognition and your bone health. I mean, soy also benefits your microbiome. Soy is a low carb protein. We're always looking for low carb proteins. And Erin sang the praises of soy and talked about why it's a food for our nutrition. You know, so rich in potassium. Potassium is really important right now. But, soy can also have a bad reputation. For example, let's say it can be identified as a trigger for autoimmune issues. Now, is that because it's soy? Or is that because it's been altered and has been GMO and that it's been hard to digest, and actually because of our agricultural practices, it's actually been implicated in inflammation or autoimmune? So I hope this helps to answer your question. So if you've got Hashimoto's, it doesn't mean you have to avoid soy. It means you want to get your labs done to make sure you have adequate circulating thyroid hormone with the full thyroid panel. We've had a wonderful presentation on what is a full thyroid panel. And most patients that come to see us have never had a full thyroid panel. Linda gives a wonderful talk on thyroid hormone testing and health. Doesn't mean you have to avoid it, just means understanding how it can affect you and your body. Hope that helps.
Okay, excellent. So let's tackle some additional questions. Thank you so much for that clarity, Dr. Tetlow. That was beautifully said. Let's see here. We have a question from Catherine. How common is estrogen dominance in postmenopausal women? Great question. So during menopause, we know that the sex hormones, estrogen, and then progesterone, and then testosterone, they start to decline. However, this does not mean that perimenopausal and postmenopausal women cannot suffer from estrogen dominance. So even though those levels are starting to drop down, estrogen can still be elevated in comparison to progesterone and testosterone to allow for estrogen dominance. So this is something that can affect women of all ages, especially because we have so many outside influences of estrogen in our daily life. We talked about those personal care products. We talked about BPA. We talked about our food sources, foods that are injected with estrogen, and we talked about all these different things. So anybody can develop estrogen dominance, even peri and postmenopausal women. Okay, let's see. Okay, I've heard another this is a question, Samia, I believe, I hope I pronounced that correctly. She says, I've heard another supplement for estrogen dominance is IC3. Can you talk about that? I think you're referring to indole 3 carbinol, I3C. But this is another supplement that is very similar. It works very similarly to DIM, which we talked about tonight. And that is a component of those cruciferous vegetables, those broccoli, cabbage, the cauliflower, those sorts of foods. And they help in a very similar way. They help with the clearing excess estrogens. That also operates as a natural aromatase inhibitor. So it works in a very similar way. In some supplements, you may find I3C combined with DIM because they work synergistically in the body. So yeah, another supplement option. And just like I mentioned, there are so many different supplement options that can help with hormonal balance. So great question, and hopefully that provided some clarity.
Zoe, I can take one.
Great.
So Cheryl asks, in regards to soy and breast cancer, I understand that soy milk isn't fermented. So would you advise against this as using West Soy organic non-GMO, or would 2/3 cup per day be okay? Use this in a latte as a dairy-free and prefer soy taste over other nut milks. So Cheryl, I don't know your individual case and the specifics around your health, but I can share just some general thoughts I have around this question. So the thing that I like about this product, this West Soy, it looks like it's very simplistic ingredients. It's filtered water and organic soybeans. So I like that it's got a minimal ingredient list, which is always a positive thing. And as I talked about soy in moderation, this seems like a good way that you would be getting it in moderation. When I work with clients, I also encourage people to rotate their foods and not have the same type of food every single day. So if you have to avoid food sensitivities, that can lead to other issues down the line. So if you're also open to trying other types, I know you don't like nut milks. I don't know your specific health condition, but you could also try like some oat milk or like a coconut milk and try rotating that with the soy just to get some variety. But overall, in looking at that product, it looks like it is very simplistic ingredients and would be a way of getting it into your diet if the fermented forms are not something that you're currently eating. But I also invite you to give that a try and see if you like it. I hope that helps.
Beautiful. Thank you, Erin. Okay, I think we have another question here. We have many questions. Let's see. Okay, a question from Cheryl. She says, sounds like supplements can do the same job as medications conventional doctors want breast cancer patients on. Would you agree medications have side effects? You're exactly right. There are pharmaceuticals that are aromatase inhibitors. that do the same exact things as some of the supplements. Now, these pharmaceuticals, these medications can be very potent. And so that is often why they are elected to be used. But you're right, they can have more side effects. And so we know that we always want to support the safety of our patients. And if we can have the same outcome, if we can use supplements that work on the same pathway as pharmaceuticals, well, let's do it, because we know that your body is going to easily recognize these supplements. They're going to easily recognize things like vitamin D and zinc that are used in the body regularly. So I love this question, because this really supports what we do, which is to help our body regain balance in the least invasive and in the most natural and healthy way as possible. And yes, it's so possible to use supplements in place of medications. But just so you know, those conventional medications, the aromatase inhibitors, do tend to be more potent, more strong, and patients take them for shorter periods of time. But I think it's so exciting that they work on the same pathways, just like how we talked about turmeric, how that works in the same pathways as ibuprofen. It's a COX-2 inhibitor that lowers inflammation and pain. So that's part of why I love what I do, because the science is there, and that's exciting. We always want to be evidence-based. Another question from Anonymous: are children eligible to be patients of PIM? If not, is there a way to find integrative practitioners for kids? Excellent question. We see patients ages 11 and up. If your child is under the age of 11, one excellent way to find a reputable, a well-educated functional medicine provider is to go on the Institute for Functional Medicine website, and you can use their directory service to find other functional medicine providers that do see children. So hopefully that helps, but if your child is above the age of 11, we'd love to see them.
I can answer just a couple questions, and we'll keep going. We do want you to take fat-soluble vitamins at the same time. That's just how they work. So vitamin D and K, they do get taken together. So we don't have an all-in-one. I know Zoe went through a lot of helpful things, so we wish we did have an all-in-one Inda, but we do not have an all-in-one. So some other questions that have to do with hormone balancing. There's a question about pregnenolone. Pregnenolone is very early in the cascade of your hormones. So if you get your Dutch test, you'll see that there's cholesterol way at the top, and then right after cholesterol, there's pregnenolone. So if you take pregnenolone, everything downstream can increase. But depending on what's going on in your body and how you're eating and your stress levels and all the physiology in the symphony, how that pregnenolone expresses itself will depend on you. So that's why you still need to know your pregnenolone level in your Dutch test to know how that's expressing and whether or not it's helping you. Hope that helps. That's for Anonymous.
Love it. Another question from Courtney. She says, at what dose of zinc requires taking copper to prevent from becoming copper deficient? I'm so glad you picked up on that. The relationship between zinc and copper, how excess copper can suppress excess zinc can suppress copper, and then vice versa as well. So I know that these answers are becoming quite similar, and but again, there are a lot of factors that will come into play here to properly answer this question. We are not just what we ingest. We're, the supplements and food that we take aren't guaranteed to be getting into our cells. We really want to, we are what we absorb. And there are many different things that can affect our absorption, our ability to produce stomach acid and pancreatic enzymes. So we also take into account foods that you're eating. Do you eat a lot of zinc foods? Do you eat a lot of copper foods? The only way to really know is to check your levels via labs, which we can do via labs like LabCorp and Quest. We can look at your red blood cell levels of zinc and copper to see what's getting into your cells, because you may be taking a bunch of zinc, but you may be having a lot of copper foods and they balance each other out. So again, remember, this is personalized medicine. This is why we check those labs. This is why we make sure that this is safe for you, because 30 milligrams of zinc for someone might be too much, and 60 milligrams of zinc for someone else might not even come close to what they need based upon their lifestyle, their ability to absorb, so many different factors which we all take into account when suggesting a plan for you. So I know these questions are kind of becoming a little similar. We say things like, well, it depends, but it does, because again, we really stray away from cookie cutter protocols. It's really about you and your body, and that's special. That's awesome. That's what we do.
There's another question from Anonymous about benefits of topical versus taking a pill, and that's important. That's also important for estrogen. And I was just at the International Conference for Functional Medicine this last weekend, and doing that for the team. And we had a presentation also about topical versus oral estrogens and how much healthier it is to take topical estrogen. And that's because if you put it on your skin, it doesn't have to go through your liver. And it's just absorbed into your blood without having to go through that first pass through the liver. And it's really the preferred and recommended way to take estrogen if you need to take a bioidentical hormone. Of course, you want to do least invasive first and not jump to hormones. And hormones need to be a discussion with your provider. So if you do get hormones, we would talk to you about where to put those, where to place them in your body, where to apply the cream. Thanks.
Mm-hmm. Fantastic. We have another question from Arena who says, what is the best way to check for zinc and copper? So hopefully that my last response answered that. We can check that via labs by LabCorp Quest, other labs very similar to that, but we want to look for the red blood cell levels. We want to know not serum, not what's floating in your body, what's getting into your cells. That tells us what your body's using and is a true determining factor of your nutrient levels. But we also have a specialty test that is called a micronutrient test that looks at a wide variety of nutrients, 32, 33, I believe, and it checks for these nutrient levels in the very same way. There are a couple nutrient levels we can check via, regular labs, but we can get a full spectrum via this specialty test that can be very helpful to guide supplementation and also be an indicator of how well you're absorbing. If you've been taking vitamin D long-term and that vitamin D comes back pretty low, hey, we have to work on absorption. Again, another key fundamental of integrative and functional medicine, focusing on some of these very basic yet often overlooked topics: motility, digestion, lifestyle factors that matter, that influence our nutrient status.
There's a great question from Courtney about maca. And it's good to be talking about maca because I think of maca as like a whole food. It's a supplement, but it really comes from a plant. It's originally used in Peru, but of course it's more than just Peru now. And I'm so glad we're talking about foods because, we have Erin on our team because we really value her expertise. And we also know that this is about how you live. It's not just about supplements and testing. And we know that about functional medicine. So maca is really good for balancing adrenals, and it's also good for replacing some of these key nutrients for the formation, and there can be fertility benefits. There's different maca formulations that are for menopause and that are for fertility and for younger years when we have different health goals. So I just recommended a specific maca supplement to a patient today and was very excited to show her the ingredients and to show her why I was recommending it and some of the evidence behind it. I love maca. And maca also it's got some natural minerals in it. It's got a wonderful phytonutrient rich, ingredient list. It's lovely.
Fantastic response. I wanted to take time to answer another question. Anonymous says, what are examples of brain fog? A good question. Some examples could include, just difficulty remembering names. Like, let's say you know someone, they're prominent in your life, and you're having a conversation and you say, yeah, I was talking to, and you blank on a name. Or maybe you're searching for your keys and they're in your hand. How many of us have done that before? Or you are having a discussion with a friend and you just kind of blank for a moment and you just can't remember what you were just saying. These are examples of brain fog. So hopefully that clears that up for you. And I also wanted to answer another question from Ashley. She says, I get heart palpitations after ovulation to the start of my cycle. I've been tested for every heart condition and am negative. Bioidentical progesterone has helped, but I want to know physiologically what is happening. I think it has something to do with estrogen receptors and nitric oxide. Any thoughts? Thank you so much. I have a lot of thoughts here, and this is pretty exciting. There's a lot of different connections in my brain that are I'm really drawing so many different connections. To answer this question and to answer this in the best way, I would encourage you to see an integrative or functional medicine provider because there are many different factors here that are going to tie in to your experience and some of these symptoms that you're mentioning. We would, again, so many different factors, some different nutrients, so, and things like that. So I would encourage you to have someone look at the whole picture here. Look at all of you to really understand what could be helpful, what isn't, and to draw these connections on a more detailed level. To have someone really put together all the different symptoms you've had, the diet you have, your movement, your stress, your emotional state, previous traumas. To look at all these different things and put them all together and then share that with you, and that's a big part of what we do too, is patient education. We want you to know what is happening in your body because we believe that you can heal yourself. We want to help you do that. You know your body, you know what you're experiencing, and we encourage that. We love the curiosity, and I just love that there's so many questions. It just says a lot about you as a person, how inquisitive we are about our own bodies. We want to provide that information for you, and that's what we do during visits. This is what's going on in your body. This is what it does. This is why it could be happening, and this is what we want to do to help you reach homeostasis, aka balance, to balance your body and let it do its thing. Your body wants to see you well. Your body wants to help keep you from symptoms and ailments, and that is what your body is seeking, and we want to help do that. So again, I hope that you will think about becoming a patient. And as you know, we would love to see you. So hopefully that is helpful.
So I would like to just answer 2 more questions, and I'm getting a prompt from Nicole. She's like, look at the time, Dr. Tetlow and team. So I'm going to answer 2 more questions. Those 2 that I'll answer are from Arena and also from Tanya. And if there's any other questions that you see, Erin or Zoe, that you'd like to field before we close out, you'll just give me a little heads up and I will not close out until you're done. There's a question here from Arena about what would you recommend to decrease 5-alpha reductase. And the first thing is to actually find out if you do need to reduce 5-alpha reductase. So that means actually finding out what your personal test results are. And then some of that is answered in Zoe's talk about which supplements have that action, but there's many foods that have zinc in them and many foods that can also play a role. So I'd get a test, and I wouldn't just make an assumption. And then if you do need to do that, the supplements that and some of the diet pieces that we mentioned tonight could be helpful for you. I hope that helps, Arena. For Tanya, best natural way to reduce menopause symptoms, hot flashes, night sweats. Something we didn't mention tonight is also just eating a low sugar diet with really healthy glycemic carbs. So you want to not have insulin swings, and that's something that can really help you with the hormonal fluctuations in menopause when that estrogen is going high and low and high and low, and every time it goes low, you have a hot flash. So when your insulin's going up and down like this, you're going to have more hormonal fluctuation. So that can be a first step. And if the lifestyle and diet pieces that we're talking about here aren't helping, seek out more help. And we'd love to talk about that in a free consultation. Are there any other items that we'd like to address, team?
I would like to answer an additional question. Let's see, it's from Gabriella. Is there a difference between vitamin D and D3? Yes, there are different forms of vitamin D. If you go to perhaps a conventional provider and maybe your vitamin D is found to be critically low in lab work, they may suggest for you an actual vitamin D medication, which is in the form of vitamin D2. We know this is not the most absorbable form of vitamin D. We want vitamin D3. And so we also want that pairing with vitamin K, oftentimes vitamin K2. There are different forms of vitamin K2. This can get really nuanced, really esoteric, but yes, there is a difference, and you will see those contrasting recommendations from conventional versus functional medicine, because we have that training in supplementation. We learn about what is the most absorbable forms of supplements, and there's different types of magnesium. All can be used for different purposes, different types of these vitamins and minerals, and that's what we're trained in. So again, hopefully that is helpful. And kind of, coming off of that, another question from Lisa says, can you differentiate between magnesium citrate versus glycinate benefits and effectiveness? There are many different forms of magnesium, magnesium threonate, a magnesium oxide, and all can benefit in different ways. At the end of the day, is it all magnesium? For sure. But for example, citrate may be more helpful for bowel movements. Glycinate may be best for people who are not suffering from constipation and they're just looking for a good absorbable form of magnesium. That's a form we sometimes use. It's just really absorbable and good kind of for general use. There's threonate, helpful for headaches. I mean, we could go on and on, but again, these are conversations we can have with our patients to tailor the supplements to you, because this can get detailed, and let's do it. Let's share that information with you, have those conversations, and come up with a plan as a team. We talk about things and make sure you feel good about this too, that you feel educated, and you can share these things with your friends, and the effects just ripple out. So many different forms of magnesium. Good question.
Thank you. And we are very passionate about this, and we could talk about this for much longer. And we are so delighted that you have joined us tonight. Thank you for taking the time to care for yourself, to learn about your body, to learn about how your body works, to learn about this balancing process and the role that you can play and things that you can do without even picking up the phone and coming to see us. We want you to be empowered and to know your role in your own health. I want to appreciate that it's time to wrap. It's time to wrap up. Thank you, Nicole. Nicole's like, it's time to wrap. So I hope everyone has a wonderful night. I hope that you feel safe. I hope that you are with loved ones, whether or not they're in person or you're feeling their support. We are here to support you. We care for our patients. We love our patients, and we love what we do. We would love to have you as part of our family if you'd like to join us. So a free consultation, or in any way that perhaps the next talk with Linda, talking about your gut health. And that's going to be at the end of July. So join us. We'll see you then. Have a wonderful night. And thank you so much to my providers, to Zoe, to Erin, to Nicole, who have worked so hard for this, to make this evening what it was. I think it was really lovely. Thank you so much. Okay. And take care. We'll just sign off, and Nicole, if you could just leave us up for about a minute and then close us out, that would be great. Okay, thank you so much. Good night.